Today, we're going to talk about hairlines, artistic hairlines, or the artistry of a hairline. And of course, as we all know, myself included, hairlines are most important, and that is the most important part of a hair restoration procedure. We're all concerned about many different things when choosing a doctor, when choosing a clinic, when deciding on something that's aggressive in regards to hairlines or something that's conservative in regards to hairlines. And in other videos, we talked about what those choices are and why you may choose either. When it comes down to the actual hairline design, this is done usually in the preoperative consultation with the doctor on the morning of the procedure, prior to any sedatives or medicine that's given to the patient. Now, you could visit your doctor in person and have this done prior, but even if that's been done, the doctor is going to go over many things on the morning of the procedure. One of the reasons I thought this was an important video today is because on the morning of the procedure, myself included, we're all very nervous. If we didn't have butterflies in our stomach, there would be something wrong with us. I mean, this is pretty intense and it's pretty expensive, and we hope that everything goes right. So on the morning of that procedure, pay close attention to the doctors and their measuring of how they're determining where your hairline placement should be. Now, I'm not going to be specific with you on this video, but the way that they do it is by the actual structure of your face and head, forehead, temporal areas, your corners up in your hairline. They have to do a measurement that they've been trained to do in order to create the proper hairline. In most all patients of all races, there is no perfect hairline. By that I mean that one side is not exact as the other, and that's the way our bodies are as well. If the doctor measures from specific areas on the face, the placement of the hairline is going to be asymmetrical. Every patient that has a procedure needs to understand this prior to the procedure. What I have witnessed sometimes, and it's unfortunate, is patients get nervous and excited once they see the finished product on either the immediate photography session after the procedure, or they get back to their home, or if they're coming in from out of state or out of the country in their hotel room, and they see that one side is higher than the other, or one side is lower than the other. The reason for this is because of what we just talked about, that you do not have a perfectly symmetrical face. There's also a lot of swelling going on, and you just had a procedure. So this is just a tip that's pointed out to patients that are looking for some information in regards to how to choose a doctor, how to choose a clinic. This is once that's all been done. I'm trying to help you understand the process of what it's like on the day of the procedure and then immediately post-operatively, and how that doctor determines the placement of your hairline. So what gets confusing to patients, because it's a lot of information and they're nervous, is they end up just kind of asking the doctor what they feel would be best. And then that doctor, of course, because we always talk about it, an elite doctor, part of my network, a doctor that's done this for years, that you're confident with, and has tons of videos and photos of examples of his work. I hope this helps. Thank you for watching. Don't forget to like and subscribe to McGrath Medical YouTube channel.